Hello and welcome to Talking Points with Dr. Anup. Today's point is giving money and gifts to patients for doing things they should already have done. What I mean by that? Many a times you would have heard that a health plan is giving away, say, $50 vouchers to buy XYZ things at stores if a lady gets her mammogram done or if a patient does something that the patient should already have done. Now, that's a very bad strategy. In the short term, the health plan may be benefiting by achieving certain goals they were mandated to achieve, like getting a mammogram done for 90% or 80% of patients, and by giving that financial incentive, they may be achieving that goal. That's a very bad idea, and the reason is, suppose this is the premium you paid, and out of this premium, this much was the money being spent for your healthcare, and this is the money which was spent for administrative expenses by the health plan. Now, nobody can print money, generate money, except the federal government. So where does this money come for getting these patients go to get the mammogram done or go for weight reduction or go for health clubs? Of course, the HMO will not cut its money from administrative costs. They are almost fixed. So the money will come from something that was supposed to be done for you. Now they will probably deny it, but that's where the money will come from. So that hole that is created in your covered care will hurt you. So this hole can only be addressed in two ways. Either by denying care for you for some other things for which you would have received care if this money was not given away as gift by the health plan to patients who, say, went for losing weight, stopping smoking, or mammograms, or different other things like that if this money did. So this hole which you see in your healthcare part will lead to either something being denied to you, which otherwise would have been covered if this money was not spent by the health plan to meet the targets of, say, getting the mammograms done, or saying that they had so many patients lose weight or so many patients join the gym or health club. But this is your money which is just being given away to some other people because they did not do what they should have done in the first place. So a lady should have gone for mammogram, she didn't go, so now she is being paid money which is your money. Or a patient who is excess in weight is being given your money to join one of the programs to lose weight, and that is not right because it is cutting corners in your care. The other way this money for this hole can come from is by raising your premiums. So ultimately, either you are losing part of your care or your premiums are going up because the health plan decided to give your money away to somebody to do things that that person should have done in the first place. The second problem with this is that those patients who did not go for something and got money paid this year won't go for the same thing next year. And once this message spreads, other people will stop doing that too. Let me explain. A health plan started giving $50 vouchers to patients to go for mammograms. If they didn't go in the past 1 year and they should have gone, they sent them a letter and said, if you go for a mammogram, you'll get $50. So the patients went for mammogram. Everybody was very happy that the health plan has achieved such wonderful results. And this is not the only health plan. There are hundreds of health plans throughout the country who have done it. So, what ended up happening? That next year, when these patients were again supposed to go for their mammogram, they were waiting for that check letter to come before they go, and they didn't go because the check letter didn't come. The other thing was that the friends of these patients who came to know that if you delay your mammogram enough, you will get paid $50 or $100, so they also stopped going. So it is a very bad idea to give money to people or give gifts to people for doing things they should already have done. Why I talk about this point? Now the federal government is also thinking of starting something like that, of rewarding people to do things that they should have done in the first place. That's a very bad idea because it will take away your tax dollars and will incentivize people who are being now rewarded for bad behavior. That is in the short term. In the long term, it will lead to a culture where everybody will be expecting to be paid to get things done, even though they should have gotten those things done for their own health and welfare. So it's a very bad idea. If you are an employer with a very intelligent workforce and you come across any such ideas floating from the health plan that your employees belong to, your employees will be subsidizing those rewards and programs from the health plan. So be very careful. For the federal government, if they start this program, please tell them that it's a wrong approach. They should find some other ways to motivate people rather than giving your money away to them to do what they should already have done